Hi, I'm Christine Nagy. I'm here with 106.7's fertility expert, Dr. Jamie Griffo of the NYU Fertility Center. Hi, Dr. Griffo.
Good morning.
How are you today?
Very well.
Okay, so we're going to talk about embryos today, and specifically, how do you know what embryo will make a baby, and why don't some do that?
Well, it's a great question, and it's also a misunderstood fact that most embryos don't make babies. We all think once an egg is fertilized that a baby will result, and that's not what happens. In fact, you could look at nature and you'll see this all over the place. You take a handful of seeds, you drop them on the ground, and 90% of the seeds don't make a plant. And embryos aren't that much different. A lot of them have a potential to make a baby, and our job as fertility specialists is to find the ones that are most likely to make a baby, and that's a difficult job.
So there's something called blastocyst culture. Can you tell us about that and how that can help?
Well, one way you can identify an embryo that's more likely to make a pregnancy is to see how it responds to our culture and watch it develop and watch it grow. And there are signs of viability in the embryo that we see in the lab that helps us select. And we've learned over the years that the longer we keep the embryos in the lab to a point, we can identify the ones that are more likely to make a pregnancy. And we spent about 7 years improving this technology, and now we culture most of our embryos to day 5. And by doing that, we're actually transferring fewer embryos, making higher pregnancy rates. And because of that, we're able to put back fewer embryos, and we're making less triplets, which is a really good thing, because multiple pregnancy is an unwanted side effect of assisted reproduction. We err on the side of getting patients pregnant by putting back too many embryos in the past, and now we've learned how not to do that.
That's amazing. Now, there's also PGD, or helping out with pregnancy rates. Can you tell us about that as well?
Pre-implantation genetic diagnosis is a technique initially developed to help patients who are at genetic risk. For instance, if a couple both carries the gene for cystic fibrosis, 25% of their babies will have this horrible illness. And a lot of these patients show up, they have a child with a serious illness, they want to have a healthy baby, they don't want to have to terminate a pregnancy. So the technology we've developed, and I actually was the first in the United States to have a successful PGD pregnancy back in 1992, is we have a way of doing a genetic test on the embryo that doesn't harm the embryo, and then we can select embryos that don't have these genetic diseases and help these couples who have this 25% risk and drop that risk down to less than 1% like the rest of us, which is pretty hard to want to have a baby or try to have a baby knowing that 25% of the time you're going to have a baby with a really serious illness. And finding out at 16 weeks in your pregnancy that your baby's affected is really an awful scenario for these patients. So this technology has really been a dramatic improvement in the ability to care for them. Now, the other thing that we've learned is that we could also screen for chromosomes, because one of the reasons most embryos don't make babies is a lot of them are chromosomally abnormal. And that's kind of a natural phenomenon, and that's part of natural selection and changing the genome, so to speak. The chromosomes get scrambled, and a lot of these embryos don't make pregnancies. And we have found a group of patients who miscarry, and the cause of their miscarriage is chromosomal abnormalities repeatedly. And so if you take this group of patients and you look for chromosomal abnormalities in their embryos, that's called aneuploidy screening, we found that we can lower the miscarriage rate in this group of patients and help them have healthy babies as well. So there's a lot of promise for this technique, and hopefully someday we'll be able to screen everybody's embryos to make sure that a healthy baby results and a miscarriage doesn't result. But we haven't quite gotten there yet, but we're working on it.
Absolutely amazing, important work that you're doing. Thank you so much, Dr. Griffo.
Great.